everyone, and welcome. If you're getting ready for your phlebotomy certification exam, you are in the perfect place. Today, we're going to focus on those high-stakes special collections, where being precise isn't just a good idea, it's absolutely everything. Let's get right into it.
We're kicking things off with this quote because, honestly, it says it all. This is the absolute non-negotiable rule of our world. In transfusion medicine, there's no such thing as close enough. Just one tiny mistake, like mislabeling a single tube, can lead to a devastating or even fatal transfusion reaction. That's why the standards are so incredibly high.
So, here's our game plan for today. We'll start by defining what makes a collection special. Then we'll dive deep into the blood bank's zero-error zone. We'll follow a specimen into the lab, cover the essential rules for blood donation, and then we'll wrap it all up with some advanced topics that you're very likely to see on your exam.
Okay, first things first, what actually makes a collection special? Well, it's basically any procedure that goes beyond your standard routine venipuncture. These are the draws that require super strict, standardized protocols to make sure that the sample is perfect and, most importantly, the patient is safe.
The number one principle here is standardization. It really doesn't matter if you're doing a simple bedside glucose test or a complex draw for therapeutic drug monitoring. The rules for keeping the specimen pure, documenting everything precisely, and ensuring safety are exactly the same. And these rules aren't just made up, they're set by major organizations like CLSI and OSHA to guarantee quality and safety no matter where you are.
Now let's step into what is, without a doubt, the most critical area for any phlebotomist, the blood bank. This is where that zero-error rule becomes a hard reality, and every single step you take is designed with one goal in mind: preventing misidentification.
At the very heart of blood bank safety is something called positive patient identification, or PPID. And let me be clear, this isn't just a good idea or a suggestion, it is an absolute mandatory process. The goal is incredibly simple. Make sure the blood you're drawing is from the right person every single time.
You know, this is a very active four-step process. First, you check the paperwork against the wristband. Then, you ask the patient to actually state their full name and date of birth out loud. You make sure it all lines up perfectly. And if anything, I mean anything, doesn't match, you stop. You just stop. You do not move forward until that discrepancy is fixed by a nurse.
And this right here, this is the ultimate safety net. We call it the golden rule. No band, no draw. It's simple. If your patient doesn't have a wristband or the one they have is wrong or illegible, the procedure is over before it begins. You have to wait for a nurse to apply a correct wristband. This is a huge safety check, and trust me, it's a very common topic on certification exams.
Let's talk about another huge exam topic: labeling mistakes. There is only one correct way to do this. You label the tube immediately after the draw, right there at the bedside, while the patient is still with you. Pre-labeling your tubes before you even start, or walking out to the nurse's station to label them, those are critical errors. They will get your specimen thrown out and you'll have to go back and do a complete recollection.
You know, every single piece of information on this label is there for a critical safety reason. We need the patient's full legal name, not a nickname. We need a second identifier, like their date of birth. The date and time are legally required, and your initials, that's for accountability. Absolutely nothing on this label is optional. Okay, here's a number I need you to burn into your brain for your exam: 72 hours. So, why 72? Well, think about it. A patient who is recently transfused or who is pregnant can actually develop new antibodies in their blood. A specimen that's older than 72 hours might not show their current antibody status, which makes it totally unsafe to use for cross-matching blood.
All right, so you've collected a perfect specimen. You followed every single rule at the bedside? Awesome. Now, let's follow that tube into the lab and see exactly why your technique is so important for the tests that come next. The very first thing that happens in the lab is the type and screen. It's a three-part process. First, the lab figures out the patient's ABO and RH blood type. Then, they run an antibody screen. This screen is a really important safety check to see if the patient has any unexpected antibodies floating around that could attack new blood cells from a transfusion.
The crossmatch. Think of this as the final compatibility test before a unit of blood is released. And the method the lab uses depends completely on that antibody screen we just talked about. If the screen is negative, great. They can do a quick immediate spin or an electronic crossmatch. But if that screen is positive, they have to do a much more sensitive and time-consuming test to find a unit of blood that will be safe for that patient.
Okay, let's switch gears.
We've been talking about drawing blood from patients for testing, but now let's talk about collecting blood from donors. This is a whole different world, with its own set of strict FDA regulations. And it's all designed to protect two things: the health of the volunteer donor and the safety of our entire community blood supply.
All right, pop quiz time. This is a classic question that you'll almost certainly see on your certification exam. Just take a second and think about it. What is that mandatory waiting period between whole blood donations?
And the answer is 56 days, or 8 weeks. This number wasn't just picked out of a hat. It's specifically calculated to give the donor's body plenty of time to safely rebuild its red blood cell supply before they come in to donate again. Definitely memorize this number.
Okay, here's another set of numbers you really need to know for your test: the minimum hemoglobin levels for donors. Notice that they're different from men and women when it's a standard or allogeneic donation. Now look at the level for an autologous donor. That's someone donating for their own surgery. The level is lower, 11.0, because the requirements are a little different.
To finish up, let's just touch on a few advanced topics. These are the kinds of things that show you have a deeper understanding of the whole process, which is exactly what certification exams are designed to test.
So we just mentioned autologous donations, right? Well, the single most critical safety step for these is the labeling. This blood is reserved for one specific person. That bright, clear label saying for autologous use only, make sure that it never ever gets mixed into the general blood supply where it could be given to the wrong patient.
All of this careful labeling and documentation is absolutely vital for a public health safety net that we call the Look-Back program. So here's how it works. If a donor from the past later tests positive for a serious infection, this program allows us to trace every single unit they ever gave. The entire system completely depends on the perfect identification you did at the time of collection.
And this quote just drives that point right home. A mistake in identification isn't just a small procedural error. It literally breaks this entire chain of public safety. It makes it impossible to find and notify patients who might have been exposed. This is why that positive patient ID is the foundation of everything we do.
Our very last topic is something called intraoperative cell salvaging. Now, it sounds complicated, but here's the key thing you need to remember for your exam. This is when blood lost during surgery is collected, it's washed, and then it's given back to the same patient. The key takeaway is what's being given back. It is not whole blood. The washing process actually removes the plasma and the platelets, so the patient only gets back their own concentrated red blood cells.
Wow, we have covered a lot today, from patient ID to donor safety. As you're finishing up your studying, I want you to really think about this question. What do you think is the step with the most responsibility? Is it that initial identification, the labeling, the donor screening? Truly understanding the why behind every single rule is what's going to make you not just successful on your exam, but an excellent and safe phlebotomist. You've got this. Good luck.